method that works for you, or maybe a topic you want us to cover. Drop us a line at Alive and Wellness, 2200 Fletcher Avenue, Fort Lee, New Jersey, 07024. Talking with Dr. Charles Simone, a leading cancer researcher in our country. His latest book is called Breast Health. It'll be in your bookstores in the next couple of weeks, in fact. And again, it's a holistic approach, I guess you could say, to a comprehensive approach which incorporates lifestyle and also getting rid of some of the things that may be making our breasts problematic. Right. And this is what I want to go right to. Also want to ask you for your calls, 1-800-988-TALK. We're going to talk with Dorothy in California in just a moment. But smoking, alcohol, and the hormones that we take in are big problems for causing cancer. We know smoking is a #2 cause of cancer in general, but specifically breast cancer. We know that 2 to 3 drinks of alcohol every week, not a day, but a week, can give a woman a 2 to 3-fold risk of getting breast cancer. 2 to 3 drinks a week, any kind of alcohol? Yes. Wine even? 1 glass of wine equals 12 ounces of beer equals 1.5 ounces of whiskey. Now, I wonder why does that increase the... Alcohol is a carcinogen. We know that. And at that small amount, it's a huge carcinogen risk. Oh, my goodness. And hormones. Now, that... Birth control pills, estrogens after menopause replacement, these are all problems with people. 4 years or more of taking birth control pills before the age of 25 will give a woman a 4-fold risk of getting breast cancer. Oh my goodness. Yeah. That's very worrisome, because we think that we need those other kinds of contraceptive devices of life. We think that we do, but there are others out there that we need to seek out and really employ more often, because these are problems. And I didn't want to make short shrift of the point about men. You said 60% of men over age 40 with enlarged breasts. That's sort of a startling thought, isn't it? And I wondered where that comes from. Well, mainly we see hormones in foods like beef and chicken. They use hormones to fatten them up, so the men are getting estrogen hormones that way. Drugs, antihypertensive agents. We have a whole list of drugs in the book, Breast Health, to help men learn what to do. And other issues, too, hormonal other issues. It's not just for women only, the problem. Yeah, so we're going to get into nutrition in a moment. Let's hear what Dorothy in California has on her mind. Dorothy?
Yes, this is Dorothy. You answered part of my question. I take hormone replacement therapy, estrogen, and the benefits are very good for me. I can't survive without them. What are my chances of increasing my risk of breast cancer? I can't imagine being without estrogen. Real good question. What a dilemma, right? It is a good question, but the studies are out very clearly that estrogen use postmenopausally will increase the risk of getting breast cancer dramatically by a factor of 2 or 3, even with the use of progesterone. That study just came out just 2 weeks ago. So there's no protection. Yes, there is benefit from taking estrogen postmenopausally. Cardiovascular risk is reduced. Osteoporosis risk is reduced. But you can do both of those things much more naturally over a lifetime and not just rely on a pill to take care of these woes for you. So would you suggest, Dorothy, just sort of start trying a few of the other natural remedies, herbs and the like? Yes, and also taking a good calcium supplement, certain nutrients to build up the bones, exercise to build up the bones. She could also have the level of her estrogen diminished, or could she not? And perhaps that probably doesn't do it. No? Really? Anytime you tamper with Mother Nature with regard to hormones, that's when you run the risk of problems. That's what it seems to be with all the scientific data that are out. I know that was the cover story in Time magazine a couple of weeks ago, just all these studies. It's a tough one, Dorothy, and we wish you well on that, but try some of these alternative herbs at least. So let's talk nutrition now and some ways to begin to change, to diminish the level of estrogen coming into our bodies then. Is that basically what you're saying? That's right. We know that the red meats and many of the poultries will have estrogens in them. We also know that the fatty content of these foods is a major carcinogen. They produce the cancers, especially in the breast, colon, rectum, and prostate. So fatty foods must be gotten rid of, the red meats and the dairy. Dairy also has the estrogen component, but also the fat. We need to bring up the level of fiber in our diet. Typically, the American consumes about 3 to 5 grams of fiber a day. And we need about 25 to 30 grams of fiber a day. That means 4 or more servings of a vegetable, 2 or 3 bowls of a cereal, a good one, and about 3 or 4 fruits a day, which is a large load of fresh vegetables, fruits, and cereals that we're not used to. We really need to do that. These are what they call phytochemicals, are they not? Well, in these foods, we'll have these chemicals that have been shown now to reduce cancer risk. In addition, supplements with certain vitamins and minerals that we've outlined in the book, which ones to take
how much of them, and when.
Understood. Yeah, it looks like the research is proving that it was never more important that we become aware of these very natural products that we have to begin to take more into our diets. Alice in New York, good morning. What's your question?
Yes, my gynecologist told me that the low-dosage birth control pills are very safe, have nothing to worry about. Do I have to worry taking it? Should I stop taking it? Am I at risk?
There's a whole chapter in the book, Breast Health, that relates to these very issues about hormones, whether it's birth control pills or estrogens postmenopausally. There is a risk with any hormonal-related milieu. When you change the milieu in the body, that's when you alter the risk.
But, Dr. Simone, I think the problem is, with all due respect, you know, many women are on some form either of hormone replacement or birth control or whatever, and we just don't know how to come off of that. So
it is a problem, but we are seeing the rise of breast cancer dramatically, and it may be related to nutrition, we know. It may also be related to the use of estrogens or hormones.
So you're saying any kind of synthetic pill is
anything
suspect.
that tampers with Mother Nature's milieu, that's when you have problems.
Yeah, and if possible, then we try to change. Let me get an audience question in.
We heard a lot about mammograms. Do you recommend them?
Yeah, we're going to talk about that briefly, but mammograms can be somewhat of a problem. It is now known that between ages of 50 and 65, that's when mammograms really have a benefit to the woman as a screening device. Younger than that and older than that, it seems not to have a benefit as a screening device. That is, if you're worrying if you have a problem, that's when you go after it as a screen.
Well, now wait, I'm real confused now, Dr. The research is changing by the minute then.
No? This is old information that the National Cancer Institute flip-flopped because of the lobbyists put great pressure on them. The scientific data show that women age 40 to 49, and again, we outlined this whole story, age 40 to 49, there's no benefit to use it as a screening tool.
A mammogram.
That's right. Huh. Now, if you have a lump there that you're looking for a problem, then you go after it with a mammogram. But as a screening device, that is, do I have a problem in my breast or not, without any symptoms, without any lumps or bumps, there's no rule for it as a benefit to survival if you have breast cancer.
But past age 49...
50 to 65, there is a benefit for an annual or every 2-year screen without symptoms. And after age 65, again, no benefit to survival. Survival is the key word. Can you change the lifespan of a person with cancer, breast cancer, or not by using a tool like mammogram? And the answer is no, except for the age 50 to 65.
Fascinating. Again, we get so much information, conflicting information, which brings us to the point of self-examination and how valuable that can be.
Self-examination, I think, is meritorious, but can raise great anxiety in a woman who finds a lump or a bump. When all is said and done, it seems a good examination by a doctor who's very competent at looking at breast and examining breast is better or equal to a mammogram and self-examination. So,
you know, it's tough to know whether our gynecologists, sometimes they help us with that, but sometimes it's almost like you're better off with a holistic practitioner who might look at the whole...
The studies show that the doctor who spends the most amount of time examining the breast is the doctor who will find the most problems. Many times, and there was a study about GYN doctors, they find the least number of breast lumps because of the time spent.
Yeah. Isn't that interesting? And also, women who have one of the worst problems, lumpy or fibrocystic breasts, and constantly are finding cysts that are usually benign, but can never know whether they're dealing with a problem.
What that woman has to do is memorize her breast lumps, know what her map is like. So if there's a new lump or bump that is not within that mapped area, that's when the patient should go to a physician.
Okay, so know exactly what you felt
Try
before.
to memorize your breast.
I understand. Now, you have a 10-point program. This is really, I think, very valuable in Breast Health, the new book, that should take us through some of the most important points that we can begin to incorporate.
Yeah, for both the woman with benign disease and the woman with breast cancer, as well as men, by the way, nutrition is the most important point. Low fat, high fiber, certain vitamins and minerals that we've outlined. No smoking. Or no inhalation of other people's smoke. That gets right into
smoking as well.
Gets right into the breast fluid within 15 minutes. Alcohol.
Yes.
2 to 3 drinks we know is a problem. You must be under 2 or 3 drinks a week.
Per week.
Yeah.
Okay.
We know also that environmental factors have a lot to do. Pesticides. We know that pesticides get into the food supply and that they are linked to breast cancer. There's no question about it. But on the totem pole of issues, pesticides is lower on the totem pole.
And make the point about genetics again. You said only 5%?
About 5% of the women have a genetic linkage to forming breast cancer.
Okay.
many times we all want to point to an issue that we have no control over, like genetics.
Sure.
But the truth is we have lots of control over our health. And our 10-point plan for breast health will outline that for them.
And if you had to just sum up in our last seconds, the one thing in terms of just expanding our consciousness, we have to just be aware that these numbers are real.
They are.
And that they are not changing unless we change our behaviors.
Yeah, we want other things to happen. But to summarize quickly, lifestyle changes will increase lifespan for patients with breast cancer. That's the salient, most important point that increases lifespan. Nothing else has been shown to do that.
And that's the one we hope you'll take away from this discussion with Dr. Charles Simone. Thank you. Always good to have you
My
here.
pleasure.
And the book is
Thank you.
called Breast Health.